Module 3, Health Insurance and Modern Healthcare. Now in this section, we're going to be talking about really the current state of health insurance and healthcare in the United States. For the most part, health insurance arose primarily as a way for people to deal with the potential risk that people experience in life in regards to illness, injury, disability, and so forth. The idea being that these things could happen at any time and can be very expensive in dealing with these things. So health insurance is a way to try to uh, reduce the risk of these things, trying to control people's risk. And this comes to the idea of risk aversion. Some people have different levels of desire for risk and what that entails for health insurance. Many people generally do not want to take risks in regards to their health. So, but what is risk aversion? This is a simple test to ascertain to what level are you or people adverse to risk. Basically is, are you willing to gamble your paycheck? Are you willing to gamble your paycheck with a coin flip? Double or nothing. If you win, you get twice the amount back. If you lose the entire paycheck. Are you willing to take that bet? That's in a way to really a way to ascertain to what level people are adverse to risk. And so, risk aversion, the definition being the degree to which certain income is preferred to a risky alternative with the same expected income. In the case of healthcare, you pay a certain amount for a premium uh, as a way of controlling for the high cost in the future due to an illness or an injury. Now, health insurance companies, much like any other company, they want to make a profit. And so, in doing so, they need to find ways to minimize their costs and to maximize their profit. And so, in dealing with healthcare, and especially with the rising cost of healthcare, they need to find ways to shift the cost away from themselves to individuals. And they do so through three specific mechanisms: deductibles, coinsurance, and copayments. Deductible really is the amount that a person has to pay before the insurance company will pay for anything. For example, if you have a $500 deductible with any healthcare plan, you have to pay for that $500 first before the health insurance company pays for anything else. This is where you have development of high deductible plans, or also what's referred to as catastrophic healthcare plans. We're talking which would have a deductible of between $2,000 to $5,000. So individuals have to pay that much money before the health insurance companies will have to pay for anything else. These are generally been popular because they're very inexpensive, but at the same time they have not been very effective in actually providing anyone with any level of health care, which we will discuss in class. Coinsurance, again, it's the percentage of cost not borne by an insurance company. For example, if you have a coinsurance of say 10% and you have a bill of $500, you would have to pay that 10% of that $500, and then the insurance company will pay for the remaining amount. Co-payments, that's a fixed cost for any kind of services. A copay, as we refer to, you sometimes see that in seeing a doctor. You would have a copay of $10, $15, $20, $25 in order to see your provider. Basically, it's just money, the amount you have to pay pretty much to get through the door. All these are just ways, again, for the insurance companies to try to shift costs away from themselves to the individual. Also, a way to trying to limit individuals actually accessing healthcare. So in a way, because with co-payments, individuals may not be as likely or as ready to seek a doctor's care if they know they have to pay for an amount out of their own pocket. So in a way, this is also seen as reducing people's access and utilization of healthcare. Now, this next portion we're talking about really has been greatly changed because of the Affordable Care Act. But I do want to mention, because this has been the way in which people were dealing with healthcare costs or health insurance costs previously. So the idea of how much does one pay for a premium, for health insurance premium, depending on the company where they're at, they may do so based on what's referred to as experience rating or the community rating. That is, experience rating, they base the insurance costs on the characteristics of the group of individuals. So they take into account issues of age, sex, other risk factors, do people smoke, and so forth. The idea being that those who are most likely to be seen as being require care will likely pay a greater amount of insurance. So in this cases, older people will probably pay a greater premium than younger people. Women has been known to pay for higher premiums than men. Smokers all across the board will pay for higher health insurance. The other way of dealing with this is what's referred to as a community rating. That is, rather than focusing on specific groups within the health insurance program, you're looking at what's available in the community. And so they take aggregate amounts of, based on age, sex, risk, and so forth, and then base the amount of premiums for that. And so rather than focusing on specific individuals, what you have on experience rating, community rating tries to develop an aggregate of that amount within a particular geographic area. Both of these, again, have been ways for health insurance companies to try to deal with a differential risk within a particular market for health insurance. Much of this has really changed so that, to a certain extent, health insurance companies can't use these ways of trying to control costs as a result of the Affordable Care Act, except in the case of people who use tobacco. That is still a factor that can be used to vary or to influence the cost of health care premiums. But for right now, people can't use gender, age, and so forth as a way to take into account the cost of health insurance premiums. Now, the healthcare system in the United States really makes up of three specific parties: the patient, the healthcare provider, and the insurance company. The one seeking the care, the one provides the care, and then the group that actually provides services. It's referred to as a market-based system. That is, health insurance is seen as a commodity, just like televisions, cars, and so forth. And so people who are selling health insurance are doing so in a way so that they can actually earn a profit. Now, there is some public and social insurance, basically government-run programs to provide health care for individuals, but these are for more specific populations, and which we'll be discussing. Now we can also talk about the different stakeholders when we're talking about health insurance and health care. We can look at the government, both in terms of the federal and state levels. When we're looking at them, their primarily responsibilities are, for one, regulation. They create legislation that influences the provision of health insurance, the activities of healthcare providers, how individuals receive funding, and so forth. The state primarily controls and licenses health insurance companies, but the federal government also provides some regulation in that regard. The other activity that happens there is the provision of government-based health insurance. Medicare, Medicaid, and CHIP. CHIP is a program primarily for low-income children. And we'll get into the details for those three in another lecture. The federal level also provides health care through the Veterans Administration and through the Indian Health Program. These are the only two programs in which the federal government, or really any government in the United States, provides and funds direct services for individuals. And so Veterans Administration provides health care specifically for people who are no longer in the military. And so they employ physicians, nurses, many other healthcare providers. They fund hospitals and other health places where people can access healthcare, primarily for the benefits of veterans. And the same with Indian Health. The federal government provides specific care for Native Americans on reservations directly. And so veterans and Native Americans are two populations that receive direct care from the federal government. The other programs, Medicare, Medicaid, and CHIP, are regulated and provided funds from the federal government, but are actually regulated and controlled by the state. So each state can have a different set of regulations or in terms of how care is provided for these different groups between the older individuals, individual, low-income individuals, and low-income children. The other stakeholders, primarily those who are providing the money and the funds to actually help people provide care, insurance companies and employers. Now, these are the ones that pay for health care, either directly or indirectly. Employers could provide health insurance directly to the employers. That's generally kind of referred to as being self-insured, or they can purchase plans through an insurance company. The insurance companies also are the ones that work specifically in terms of providing payment for health care for individuals. And so these are the groups that healthcare providers and patients interact with in order for them to actually receive payment for that care. And then we have the healthcare providers and people. One provides the care, one receives the care. One needs to handle the payment either out of pocket or manage to deal with the paperwork. And these two are also the primary group in regards to who makes primary healthcare decisions. That's not to say healthcare decisions are not made or not controlled or influenced by any of the other groups. There are certain legislation that may promote or limit the kinds of healthcare individuals can receive. Insurance companies, employers may limit the kinds of items that may be paid out for a period of time. And so the idea of people having ultimate control over their healthcare decisions really are not there. There are still